Hello, my name is Lydia Mutinana and you're watching Open Studio right here on Cape Town TV. I am not alone. Today I have two guests who's going to talk more about what they do and why they're doing it. Hello, would you like to introduce yourselves?
I'm Megan.
Sure. Good morning. I'm Ryan Dowie. I'm blessed to be in Cape Town.
Yeah, we're in Cape Town.
Absolutely.
So we don't know what you do, and people out there don't know what you do, and we would like to know what is it that you do and why we're here.
Okay, Ryan.
Sure. Excellent question. Why are we here? Megan and I, we're very fortunate and we're blessed to work for South Africa's most loved and most trusted non-profit organization called Pink Drive.
Okay.
And what we do is we primary breast cancer education, awareness and screening. And the whole idea behind our campaign is to champion equal access to quality healthcare for medically uninsured persons living in rural, township and 7 urban communities across South Africa. So we focus a lot on breast cancer and prostate cancer. And the idea is that we want to prevent as many people from dying from a treatable disease due to late detection.
Mm. So you had this idea, right? You had this concept. Did you just like wake up one day and you were like, okay, this is what I'm going to do? Or like there was a process, like, I don't know, like...
Sure.
Megan, would you like to take that?
So it wasn't our idea.
Oh, okay.
This comes
Well,
from.
we can claim it.
Yes.
Sure.
I'm a mammographer, so I'm the one that does the mammograms. And this whole concept of Pink Drive comes from a lady called Nolan Cochin, and she's our CEO and founder.
Okay.
And it was in 2009 that she found that there's a need for us to get something in South Africa where we can take the services out.
Yeah.
And she started
Correct.
Pink Drive with one truck.
Correct.
Yes.
Wow.
Absolutely.
Okay, so you would. So she started it. So you wouldn't know why the name Pink Drive, would you?
Okay. If you think pink, breast cancer,
Okay.
and drive, because we've got mobile units, so the two of them get together, pink and drive.
Okay.
Correct.
So South Africa has many challenges when it comes to awareness. Like for myself, for instance, I don't know much about breast cancer. I don't know much about. I'm not aware. It's not something that I hear every day and stuff. So how do you how do you fit in that? Like how do you create this awareness and how do you work your way into getting this thing out there or like the information out there for people?
Sure, it's a great question. It's a many-tiered approach to education. So one is just to go back to your previous question, one of the reasons Pink Drive was founded was because of the inadequate access to primary health care. So if you look at a private institution, right? Let's take Discovery Health as an example. You got a medical aid. Something's wrong with you. If you don't feel well, you show up to the hospital or to a clinic, you slap your medical aid card on the table, you say, please help me. Right? Access to screening, everything is right there. Now, if you're living in a township, rural community, and let's say you've got a suspicious lump in your breast, right?
Right.
But you don't know what it is. Then you show up to a clinic and you're living in Gugulethu as an example, right? You show up there and they say, look, you've got a suspicious lump, you need to be referred for a mammogram. You say, okay, cool, well, now I've got to travel to Groote Schuur Hospital and follow the chain of process. So basically to Groote Schuur Hospital, and because there's a lack of mammogram facilities, I'm just using an example, you find that your intervention before you get a mammogram might be up to 6 months.
Okay.
Okay, so now there's a huge gap, which in that period you might even succumb to it, right? To breast cancer. So why Pink Drive was founded was to bridge that gap between the access. So what we've done is Nolan Cochin, who's our CEO and founder, is a social entrepreneur, and most of our colleagues are medical professionals.
Yeah.
So they saw the gap, and being a social entrepreneur, she found that she had a tangible solution towards South Africa's problem. And the one is that providing these investing in units, okay, mobile health units that can provide cancer awareness and cancer education, demystify a lot of the myths, because unfortunately in South Africa we're still under the assumption that breast cancer is a white person's disease, white woman's disease.
Oh yeah.
You know?
Yeah.
So basically what we do is through our partners, we partner with clinics, we partner with hospitals, And we take these these mobile, I say little, but it's actually huge. These our trucks are, they're mammoth. And we take our trucks into the communities, and through our partnerships with the hospitals and the clinics, we provide cancer awareness and education drives. And because we are mobile, means we're accessible.
Yeah.
Okay, so the idea behind it was to take these mobile health units, mobile health clinics, and provide our services across the country, basically to any community that can be accessible by road.
Just to add on to what you're saying, when I was doing my research about this whole breast cancer and the pink drive and stuff, I came across this one sentence that was saying that in South Africa, we're not doing like a good job or a great job at actually creating awareness. And we think that this disease, as you said, it's a white person stuff, but it's actually not.
Correct.
And I feel like the less we are educated, the more we are prone to actually living with something that we don't know we're living with.
Absolutely.
You know.
And that's a very real challenge, especially when you go outside of the metropolitan areas. You know, you go into like the rural communities or the townships. I mean, I'm from the city, you know, well traveled individual, and I found out about breast cancer. I think it must have been about 2015. You know, like 2015.
Right.
I'm not going to expose my age, but you know, I mean, I went 20, 30 odd years not knowing that breast cancer existed. Not even the fact that it was a disease for black and white people, but I didn't even know this thing even existed.
Exactly.
So it's when it comes to like access and some of our challenges and education, it's a problem.
It is.
Okay, so you can imagine yourself. I mean, I'll share an example with you. When I joined Pink Drive, one of our first outreaches was to the North Bushbuck Ridge in Mpumalanga, and we took our trucks and we're providing a cancer screening, and there was a lady that had a lump in her breast, and she was traveling from Bushbuck Ridge, okay, one of the communities, to the local hospital, and because the hospital did not have mammogram machines, she went back and forth for about a period of about a year.
Right. I don't want to cut you, but we have to take a break, and the conversation will continue just after this.
100%.
Okay. Don't go anywhere. We'll be coming back. Welcome back. You are still watching Open Studio right here on Cape Town TV, and I'm still with me. I still have Megan and Ryan, and we are talking about the pink drive. The conversation is still happening. I wanted to ask you something when we were still talking. It's just a random thought that just came up. So we're talking about breast cancer, right? That's just a separate topic. We're talking about breast cancer. Do you have like an age requirement for you? Like, how can I say it? Can you be 19 and have breast cancer?
Can I answer that one? So, breast cancer is not an age thing.
Okay.
It's not a race thing.
All right.
It's not a gender thing.
Okay.
So, the youngest case that we at Pink Drive know of was a 3-year-old that got breast cancer. And that's not in South Africa, but the youngest case I know of in Cape Town was a 21-year-old. So it can happen to anyone. So there's no age to say, okay, I only need to check myself after 40.
Yeah. Like saying that, because I remember I actually was at this governmental hospital, and I was thinking to myself, I want to check myself, like cervical cancer, breast cancer, you know, you name it. And they told me that, no, if you are under, and at that time I was still in high school, and they were like, no, if you were under 21, then I don't think that you need to worry yourself about these things. So that's why I was asking, like, does it have any age? Does it have, like, do I have to be under 21 to have breast cancer?
I think that's where Pink Drive also starting to bridge the gap. We're going out to schools to educate the young people.
Oh, yeah.
So they can be more aware of what they need to check for, and that they actually do need to check. And unfortunately, our people go to the clinics and they don't always get the answers they need.
Exactly.
And that is why we go out and we'll educate the young kids at school already. So they can go home and educate the rest.
So you don't work alone, right?
No.
You work with other health. You work with community, other health communities, and all those things. How do you do that, and how has it been working?
Sure. So Pink Drive is an independent entity.
Yeah.
Okay, we operate privately as a non-profit organization. However, our service to the community is through our partners. Can you imagine us just showing up to the middle of Cape Town city centre, putting up a mammo truck and saying, hey, everybody wants a free mammogram, just show up.
Yeah.
You know, it'll be absolute chaos. And two, without the information about the service, it'll be kind of useless. So what we do is we partner with government academic hospitals, and we partner with local clinics as well. So how the process generally works is that we'll go to a hospital or a clinic, and we say, look, we're from Pink Drive. We'll then network with the sister or the person in charge. And we say, look, these are the sort of screening services that we'd like to provide for your community. So our services is two-tiered. One is a mass screening, which you would do clinical breast examinations.
Okay.
And that's just general for the general public. So everybody will show up to receive the service will get clinical breast examination, and that's for all ages, male and female, because yes, males can get breast cancer.
Ooh.
Yes.
Okay.
So we will provide that sort of service, and then we'll also provide some education on signs and symptoms, when to look for breast cancer and what to kind of look for, right? When and how. And that's a mass screening. Okay. Then the next part of the service is for the mammograms. So one of your questions earlier is, you know, along the lines of mammograms, it's prescribed for women over the age of 40. Okay, so if someone comes to a truck and there's a suspicious lump within their breast, and our nurses, who are the ones that basically man our trucks, are fully capable to basically write a referral. We send them to the mammogram truck, which is will either be next or will be part of the same unit. We provide the mammogram free of charge. So then, also because we're working with our clinics, the patients then become part of the system, which we're able to facilitate instead of us again just slap bang in the middle of Cape Town city centre. So yes, it's absolutely essential that we work with government hospitals for that process, because there's nothing worse than imagine us screening someone for a lump. We say, okay, cool, well, and we able just to do the diagnostic part to say, okay, cool, there's a lump. We actually got to get radiologists or specialist doctors to provide a reporting on that. Okay, we are not qualified to do that. And then once the radiologist confirms that you have breast cancer, you then got to get sort of treatment, which is where we hand the patients over into the system. So that's why it's so important that we work within the current infrastructure.
So you said men can actually get breast cancer.
Yeah.
Yes. So this is a very important thing.
Like,
Because
not many know that. Sorry, not many know that.
Ignore, or men think they can't get breast
Yes.
cancer. But if you've got a nipple, you've got breast tissue. And if you've got breast tissue, you can get breast cancer.
All right.
And men also have lymph nodes under their arms. So it's a possibility that they can get breast cancer.
I was actually shocked. I was like really shocked, and it was one of my questions, like true or false, do men actually get breast cancer?
Yes.
Like it's something that I never really...
an easy way, a way to remember it. If you've got a nipple, you've got breast. And we all have nipples.
Which is true, but it was really something that I never thought of, and I'm sure that nobody knows about, or maybe a few if there is, but we're not really informed about that as of. So has Pink Drive ever, okay, your recent award for Pink Drive, when was that, and has it ever received?
Sure, 2018, actually about a week ago, our CEO won the Most Influential Woman for Africa award.
And how did you feel? Like, how did the whole crew feel, the whole team? And
you know, it's an overwhelming feeling, to be honest, because I mean, Pink Drive, as small as we are, makes such a significant contribution to the country. So to be recognized for that is astounding. Yeah, you know, all of a sudden we become famous, you know?
Yes.
Yeah.
And it's for doing the work that we're supposed to do.
Because for us, we go out and we do what needs to be done, and then you get a surprise that, okay, award comes towards Pink Drive.
Amazing. We have to take another short break, but we will be back, and I'll still be with you here, and the conversation was going to continue. welcome back, and I'm still with Megan and Ryan, and we are still talking about the Pink Drive. So, Megan, I think this is for you. The Pink Drive started off with mammograms and added other services in there. And what are those services? And
So we offer the mammograms.
Yeah.
We do clinical breast exams. We do education. We teach people how to do their own breast exams.
Okay.
And we've added a male campaign as well, where we do prostate testing, and we do education on prostate cancer and testicular cancer. And then we've added pap smears now as well. So yes.
that's actually when I was going to talking about pap smear and stuff. They said to me that I couldn't do a pap smear under 21. I mean, is that true?
Okay. Pap smears are, you should actually start having a pap smear when you're sexually active.
Oh,
So that plays a big role.
yeah. So I was gonna ask. You also have educational units, and how is that working?
Sure. So the educational unit, right, is prime for education. Because remember the mammogram trucks has specialized machinery, right, and also has specific criteria. So unless you have a history of breast cancer within your family and you come a referral letter, that service is restricted for many women above the age of 40, unless you meet very specific criteria and are being referred. So versus with the education unit is where we do our clinical breast examinations. It's also a private unit. It doesn't have any technically sophisticated machinery.
Oh.
So that's where let me say for the sake of the conversation, the masses will come through. Okay, so within there you will have a nurse that will show you how to do the clinical breast examination, education, and the signs and symptoms that we spoke about earlier. And it's basically serves the same purpose in regards to like the whole Pink Drive.
Okay. And the doctor's room. How is it, and how does it work?
Can you repeat that again?
The doctor's room.
Okay.
Yeah. What is the doctor's room, and how does it work?
Sure. Well, all the rooms are actually doctors' rooms.
Oh, okay.
Yeah. I mean, the only difference between the doctors' rooms is that the one side of so the mammogram trap, as an example, the one side has the mammogram machinery, okay, which is a doctor's room, so it's fully secured, fully private, well lit. And then the other side of the room is where we do our cervical cancer screening, our pap smears, which is also the doctor's room, well lit, secured, and private as well.
And who
And,
manages?
and I think what the whole concept, if we talk about the doctor's room in our setup, is the privacy the patient has.
Oh, yeah,
So
that's very
we're a mobile unit, but we're still professional. The patient still gets their privacy, and as they would get in a doctor's room.
Yeah. So who manages the health units?
That's a great question. We have a team of absolute champions. Megan is one of our mammographers. Okay, so she has the capacity and the skill of providing mammograms. So Megan will be one of them, and then we also have nurses that are trained and qualified to do clinical breast examinations as well as the cervical cancer screening.
Yeah.
And they're the ones that actually power the units, because I mean, without them, it's just a truck.
Yeah.
You know, the machinery is just there. So they're the ones that actually go in and interact with the patients and provide these sophisticated services. So
Yes, but we also need to keep in mind that the people in the office, like Ryan, them, they make it possible for us to be out.
Oh, yeah. I heard
So
you're
it's
the
not
general
just
manager. Yes, you are.
it's not just us. They also make it possible for us to be able to go out there,
Yeah.
because it's not just about getting in a truck and going.
Yeah.
There's a lot that needs to be taken into consideration, like our fuel and all of, and
Yeah.
they take care of all of that for us.
So you do all the papers, and they
Correct.
do the work.
the facilitation. You did the desk job.
Yeah, you there behind
Yeah.
it all, and
They're
you
behind
get
the
your hands
scenes, yes.
dirty. Okay, so when was when was the mammograms invented, and how effective are they?
Okay, so mammograms go way back to 1966.
Okay.
And that was when the first mammogram was done, the first compression mammogram. And then in the 1970s, we started having units all over the USA. So that's how far back it goes. But things have developed, or technology has changed so much over the years that we if you have to compare the machines that was used back then and what we're using now, it's a huge difference.
Yeah.
And how accurate is a mammogram? Up to 80% accurate. About 13% of breast cancers might not be detected by a mammogram, but it's very accurate.
Is it? So how is it performed?
Okay. Can I move? So, when we do a mammogram, we've got a machine, and it's an X-ray machine. So, yes, the patient gets undressed, and we position the patient's breast in the machine, and we do compress the breast out, so we flatten it out. The reason why we compress is, I like to use a packet of marbles as an example.
Okay.
So if I put a packet of marbles in front of you and I keep it like this, you can't see all the different colors.
Yes.
But if I put it down and I flatten it out, you'll be able to see all the different colors. Your breast is made out of different layers of tissue. So if we just take an X-ray just like that, then we're not going to be able to see through all the layers, and we might miss a lump in between.
Okay.
But if we flatten it out with a compression, then we'll be able to see through all those layers. And also it stabilizes the patient, and it gives less radiation. We use less radiation with compression.
So, what are the myths or hearsays about taking a mammogram test?
There's one that I really feel that we need to clear out.
Okay.
And that is that people think that a mammogram can cause cancer.
Oh, yeah.
And we need to keep in mind that a mammogram is a normal X-ray. And with a compression, the radiation is very, very low. So one mammogram is the same as your environmental radiation for 2 months. So it's once a year or once every second year you have your mammogram done. So the pros outweighs the cons. And another thing is that we hurt people with a mammogram.
Okay.
It does not have to hurt. Communication is a very, very important thing during a mammogram.
Yeah.
The mammographer can communicate with the patient on how much compression they need, and the patient can communicate with the mammographer on how much they can handle.
Oh, yeah.
So don't just keep quiet and think, okay, she's hurting me, and yes.
Yeah.
And another thing that I need to add for our viewers is that when you go for your mammogram, if you walk in tense, you're going to pull up your shoulders like that.
Oh,
and we
yeah.
need to use this muscle when we do the mammogram. So if you're pulling this direction and we're pulling in the opposite, that is when it hurts. So if you can calm yourself down, it makes the process easier on you and on the mammographer.
All right. So how do we get a hold of Pink Drive?
Sure, good question. www.pinkdrive.co.za.
Thank you so much. Like you have been lovely guests. Like this has been a very informative conversation. Like I've learned a lot. I've learned so much, and I'm sure the viewers as well have learned a lot. That's it from me, Lydia Mutinana. This was Open Studio right here on Cape Town TV. I'll have to say goodbye.